first and foremost as sort of stewards of public funds that only people who need the benefits and services should get them, people that qualify for them. But work requirements, it's more of a slogan than a rational policy to enhance anything, frankly. Work requirements are not designed and based off of science to root people out of getting health care that they don't need or qualify for. Work requirements have been proven in the states that have them to be nothing more than artificial hurdles and bureaucracy designed to get people to give up, right? Designed to get people to jump through hoops and hurdles that makes it difficult for them to maintain their health care coverage, even if they deserve it. In reality, the vast majority, in the 90s, percentiles of people that aren't pregnant women, children, disabled, nursing homes, right? The vast majority of those folks already work, particularly with the expansion population, and in Oregon, the Bridge program. These folks are already working if they can. They just don't make enough money to be able to afford to pay the premiums for health care and to deal with the co-pays and the deductibles. And so the state and the federal government have decided that we can prop them up and assist them in getting what they need. And so I think at their face, work requirements are more posturing than policy. They're dangerous and damaging. If that is a requirement at some point, I can guarantee you that we will shift our efforts to working closely with people to get through those hurdles and those bureaucratic hassles that will be put in place. And, I know a number of plans that work in states that already have these requirements. And this is actually a diversion from monies and funds that could be going directly to healthcare, but they take their efforts and they have programs to get people into work training programs or to navigate the forms and the formalities of getting submissions in. And that's what we'll do if it comes down the pipe. But I think it's ill-conceived. I think there are other terms I have for what I think of it, but it is not going to identify people who don't deserve health care and root them out at its core. I think that what's typically happened is the requirements for those programs are such that someone has to, file a form every 2 weeks or every month and has to, resubmit, and they have to go online to do it, or they have to do it in these hours, or call a line that's got a, 7-hour queue, or, right? I mean, I think it's that kind of administrative burden that not only is a burden to the individual trying to get care, but to the health plans, right, who have other things to do besides that, and to the state and local governments who should be using their resources for other more important things. At the end of the day, I don't believe it saves any money, even when they get people off of the rolls, because uninsured people will access the healthcare system anyway. We've learned that they will access the healthcare system anyway, but they will access the healthcare system when they're more acute, when they're going to the ER, when they're showing up in the hospital, when they've got cancer that's stage 3 or stage 4, when they've got conditions that can no longer be managed. And that will cost society a whole lot more money than getting them in for their physical and their yearly labs. And that's where we prefer to put our efforts.